I'm a fellow of nephrology under the West African College of Physicians.
As a practitioner, I'm sure you're familiar with continuing medical education, continuing professional development. How important is CME CPD in your practice?
Oh, CME is very, very important. You cannot kind of take away the importance of CME because the landscape is always changing. New things are always coming out. Science is moving at a fast pace right now. New drugs are coming out. We are learning new things. So if as a medical practitioner, you are not continually updating yourself, you will lose touch of what is going on. Like I've had cases where, let's look at chronic hepatitis C, for example. Not so long ago, we didn't have cures for it. And now we have drugs that can literally cure. So if, as a medical practitioner, you're not aware of these things, you will be doing your patients injustice. It will not be fair to your patients. So as a medical practitioner, you really need to update yourself. You really need CME so that you can keep abreast of the things that are happening in the medical field.
If practitioners don't update their knowledge through CME CPD, what would be the impact on the patient that they're treating?
Oh, the patients would not be well treated. It would lead to mismanagement. It would lead to mismanagement because that would mean the patients are not getting the best of care that is available at this point in time. So doctors, nurses, medical practitioners just have to keep abreast with what is happening so that they can give their patients the best of care. So it could lead to death. It could lead to injury. It could lead to significant morbidity.
Now, some of the healthcare professionals I've spoken to in Africa tell me that access to CME, CPD can be a challenge. In your area of practice, and especially in Nigeria, do you come across the same challenge? And if not, are there any other challenges that you may come across relating to CME, CPD?
Yeah, right now I don't face a lot of that challenge because I'm in the teaching hospital. So because I'm in the teaching hospital, we have a lot of medical education, a lot of conferences. As a nephrologist, the associations I belong to, they organize a lot of CMEs, and during conferences, CMEs are organized. So because of it, I'm not facing that challenge right now. However, I can tell you that before I started residency and started working in the teaching hospital, I faced a lot of those challenges. One of the problems was being able to get to the location. Sometimes where the CME is holding is so far away from you, and you're trying to meet up with your 10 CPD points that you need to complete in the year, and you have to travel just to be able to meet up. So that used to be a problem. And then sometimes, even when it would be holding in my location, the timing might not be convenient. Sometimes I had things to do, and then I would have this CME I could attend. I would literally be struggling because I wanted to take advantage of the fact that it was taking place so close to me, yet it would mean sacrificing some other thing that I needed to do. So time and location used to be a big problem for me, and I imagine that it would be the same problem for people that are outside the teaching hospital setting. And I think it would be even worse for people that are living in the rural area, because then I was in town, I was experiencing this. For people in the rural areas, that would mean they would even have to travel even further, and then the timing would also be inconvenient, but they would have to do these things just to be able to be allowed to practice the following year, because you need 10 points each year to be able to practice. So it can be really be an inconvenience, but you just have to do what you have to do. But it can be quite challenging, really.
Yes, it's interesting because all the other professionals I've spoken to said almost the same thing in terms of the challenge. Another challenge that they brought up was cost. Would that be an issue also?
Yes, cost, of course, cost is an issue. Costing is an issue, but like I told you, now, for me personally, it's not much of an issue because most of the CMEs I attend now are part of my conferences, which I would have gone for anyway. So it's I kind of get the advantage of 2-for-1. But for people who have to travel, who are just going because of the CME, the costs definitely add up. We are talking about the cost of the CME, the cost of traveling, the cost of what you would have to leave to travel, and all these things add up to pose a challenge to the person.
I hear you. And that brings me on to asking whether a program that is available online, that is accessible at any time, would be of value.
Definitely, definitely. In fact, since the COVID, online CMEs have become more popular. Before COVID, they were literally so few. But now online CMEs have become more available, although the ones that I've seen still have a time to them. So maybe somebody would be organizing a CME for, let's say, Saturday, 4 to 5. So even though it's now online, so it takes away the issue of traveling and cost, but you still have a problem with time because the time might be wrong for you. So, but if it is possible to have a CME that you can log on and take your CME at your own time, at your own pace, and you don't have to travel, that would solve a lot of problems. Okay, and then sometimes you may not have the full hour for the CME, but if you have something you can do, you have 30 minutes, you do 30 minutes and then log off, and then some other time you go back and do another 30 minutes and complete that CME, that would really, really be helpful to medical practitioners who need to do CME.
Yeah, that's great to know, especially knowing that Milo courses are all online, taken at your own time and at your own convenience, and hopefully at a reasonable cost. That's great. Now, I know you've been involved in many of content development and being a subject matter expert on some of the courses that Milo has put together. What would you say stood out to you about Milo course content?
Okay, what stood out to me was how the courses had the most important details that a medical professional, at least a general practitioner, would need at any given time. And then secondly, most of the information that was necessary or that a medical practitioner living in Africa would need, because sometimes we go online just to update ourselves, and then some of the things that you see or you read, some of them you cannot really practice it in your environment. So, but with Milo courses, you are getting information that you can use in your practice. So that's one thing that really struck me. And then another thing was that some of the content that I reviewed, the creators really gave up-to-date information. They were not giving outdated information. They gave up-to-date information and easy to read and easy to understand, with practical tips for, practical tips for when to admit a patient rather than treat as an outpatient basis, when to refer to a specialist. And then those kind of information is really super helpful to a medical practitioner. So the things that struck me the most were how up-to-date they were, how relevant they were to the environment, suitable things they could use practically, how easy to understand the courses were for anybody, for any medical practitioner using it. So these things, I found them really, really interesting, and I liked them. Those are the things I really liked about the courses.
Oh, thank you for those endorsements, I will say, because that has been the focus of Milo, knowing that practitioners in Africa do not have the same level of resources that are available in other parts of the world, but making those resources accessible and relevant. I think the relevance is the word that I underlined when Milo was being created. It has to be relevant. So I'm glad that you found it useful and relevant to the target audience. Now, you have been involved, and I know that we have worked together in many of the courses and other contents that you've contributed to Milo. But I'm the face of Milo, but there's a whole team behind me. So what would you say your experience working with the Milo Initiative? I would say maybe me, because you're the one we interact, but I would like to say team, because while I'm the face, I represent the team. So what would you say your experience has been, so that others who are interested in joining us will get a feel for the kind of people we are?
Okay. Oh, my experience working with Milo has been truly, truly wonderful. One of the things that struck me when I first had my first contact with Milo, I can still remember that day pondering over my laptop, going like, do I want to send this message or not? And then finally going like, oh, just send it. And when I sent it, the response I got. So one of the things that have struck me about Milo is the willingness to learn from people. So like say, oh, okay, let us take a look at this. With some other people, you might find people getting defensive over what they are doing. But working with Milo, what I've noticed is the willingness to learn from other people, to accept feedback, to act on feedback, and then to give feedback in a constructive manner and in a kind manner that makes working really easy. Sometimes when you're working with people, if feedback is not given well or received well, it can make it very difficult to work, make it very difficult to express your thoughts or your ideas. But when you're working with a team where everyone is kind to each other, kind in the way they communicate, kind in the way they give feedback, and then humble in the way they receive feedback and act on it. And if there are issues to clear, I just like the whole atmosphere, really. That's just what I'm trying to say. And I think anybody coming to work with Milo, I should have no fear, really. Person is definitely going to enjoy working with the team.
Well, thank you for all those kind words. And my personal approach is, because the end goal is improved health outcomes, if information is not accurate, it's just as good as bad information. And that has consequences. And it could lead to unnecessary death or morbidity. So I am not personally a healthcare practitioner, and therefore I rely on people like you and, with the expertise. So it's in my best interest, or in Milo's best interest, to listen to the experts and shape the content according to what is best for the patient, because that's the bottom line. I'm sure you're a practitioner because you want to affect the optimal outcome for your patients. So I'm glad for those kind words that you just said. Now, would you recommend a Milo course to your colleagues in Africa?
Yes, definitely. No hesitation. I would recommend it to anyone in Africa.
That's great. That's great. Last but not least of my questions is, we are looking at, well, actually two. We are looking at translating content and also having an app. The reason being that while English is universal almost, but there are certain parts of Africa that require their own language. I'm talking about things like Swahili, French, maybe even Dutch. Do you think that would be a good idea?
Okay, definitely, because not everyone speaks English, and I imagine the Francophone countries would appreciate courses like this in French. So yes, it would be nice to have courses available in other languages to make them accessible to practitioners in non-English speaking countries. So yes, translating them would be useful.
Yes, that's great. And finally, about an app, the reason being that people who are working in the village setting or in the rural setting can download when they are when they have access to internet, say when they're in the city areas. Creating an app, would that be useful?
Yes, because we cannot take away the fact that some people are in locations where the internet is, even if it's available, is shaky. Mm-hmm. So sometimes you just need an app where you can download these things so that even when the internet is shaky, you can still have your courses. So an app would be very helpful for times where the internet is either unavailable or shaky.
Mm-hmm. That's great.